So I want to welcome everybody to our day-long workshop or Uncommon Dialogue. My name is Bruce Cain, and I'm director of the Bill Lane Center for the American West.
The newest PIN stands for the 17 Sustainable Developmental Goals of what the UN enacted in September of 2016. It could be hunger, it could be women, it could be education, it could be climate, it goes on and on. It could be poverty. And in essence, some of that's what we're going to talk about the rural West. Different politics, but not much of a different issue. Ownership, power.
I think about three main challenges in encouraging the evolution of healthy, vibrant communities in the rural West. The first is that there needs to be stable economic foundations. The second thing is that those communities need to operate in a context of environmental security where they have access to clean water and clean air. And then third, I think that there needs to be an increased focus on what it means to have a healthy lifestyle.
So the strength of the university lies in its analytical ability to look at the problems and understand the underlying driving forces. What are the highest priority things, and what are the things we can probably change most effectively? Those are the kinds of issues that I think we ought to be grappling with and deciding which ones can we change most effectively.
We have something called the Eccles Rural West program, Eccles family, and the idea of that was to get Stanford out of the bubble and out into areas of the West, and to be able to work with stakeholders and academics from other institutions to create a network and to figure out where Stanford can make a contribution. And one of the most important themes that came up over and over again was the state of health in the West.
I do appreciate the chance to be here. I really enjoyed the event in Santa Fe that kicked off this initiative. For many of us, it's easy to understate the connection between the environment and rural health.
And working in the Department of Health has given me that opportunity to work with a number of different partners and people to think about, in the rural West, how do we impact health for the people in our communities who are really invested in who they are in their communities.
One critical thing to recognize, healthcare is not particularly strongly associated with health. Not just in the US, but in any modern country today. It's really not a healthcare system, it's a disease treatment system. If you're interested in health, the number one driver is behaviors.
While there are challenges in rural areas, there are also tremendous advantages in terms of relationships and cohesion. The word tribe was used, and I think Humboldt is definitely a tribal place.
I wouldn't want to confine our potential is here to any one condition or any one discipline, but rather look for more integrative approaches that really can address the full dynamic and underlying logic of the disparities we see in some of these data.
We try through these institutes to be very outward-looking, forward-looking, innovative, and take the best new knowledge that we can create at Stanford to look for solutions. So I think as a research university, we have very many opportunities, but we also know that we need to listen to the people who are experiencing the impacts of disparities, whether it's in healthcare or other aspects of their lives and well-being.
What I think Stanford could do here in this area is to focus on a mission of increasing the flow of high-quality information to the public through journalism about democracy, and in that way improve the health policies that affect the rural West.
As Stanford moves forward with some of our integration and work in the rural health community, what does the community need? Make sure that we have our finger on the pulse, that we actively engage the community to ask them who are the stakeholders, who really care about this, and how can we interact with them well.
quite remarkable to me how dramatic the change in insurance coverage has been just over the last few years in these states. I think one thing to note with Medicaid that I should have emphasized earlier is that Medicaid is not one program like Medicare. Medicaid really is 51 different programs. So Medicaid in Utah is different from Oregon, different from Montana, different from Alaska.
We have a set of challenges across this country that lead to dramatically different outcomes, particularly for children. And the United States has always been about opportunity for all children. And healthcare is a cornerstone thing of that. I think that's something we should be committed to as a country and in all our communities.
Stanford is ideally positioned for the future because of the technologies you can bring to bear, but you have to find test beds where you can take these wonderful ideas and try them in a real setting and find what really works. You have to somehow adapt your theory to the reality. That requires partnerships.
And I think that we need to have the combination of patience and persistence to really invest in developing relationships that have the potential to pay off in the long run.
Thank you so much to the panelists so far today. It's just been so interesting, and it's always interesting and worthwhile to come. And what's really great is that the staff at the Bill Lane Center then takes all this information and they take it to the next step.
Let's start on the bottom up, and let's get out there and be, here's my bias, let's be a little bit more proactive and pro-research and action. Because if you research something for 5 or 6 years and a person's got a problem today, they say, that's great, but what can you do to help me today?